Now we will try to go to Morocco, where we have Abdallah. Abdallah, can you hear us?
نعم نعم.
Please go ahead. مرحبا بك.
هل تسمعني؟
نعم.
شكرا لكم على اختيار سؤالي. سؤالي كالتالي: هو معدل انتشار فيروس كورونا بالمغرب، مع العلم أننا أصبحنا نسجل أكثر من 1000 حالة في الأسبوع. هل الوضع الصحي مسيطر عليه؟ ما هي التدابير التي يمكن أن يتخذها الشعب المغربي والمسلمين عامة خلال فترة الصوم في رمضان المبارك؟ شكرا لكم.
شكرا لك على هذا. So, question is about Morocco. Morocco has a reported number of cases, more than 1,000. How WHO is helping Morocco, especially now as we come to the month of Ramadan?
Assalamu alaikum. The WHO has been working very closely with the government of Morocco. In fact, very closely indeed with Morocco on preparedness for epidemics and emergencies in general. We sadly had to postpone a hugely important global meeting on exactly this topic, which was actually planned for last month in Morocco under the stewardship and sponsorship of the King, on the need for accelerated global epidemic preparedness. So we've been working extra closely with Morocco over a large number of months on the topic of epidemic preparedness. With regard to the response, our Eastern Mediterranean Regional Office based in Cairo has been working very closely with Morocco on diagnostic testing, on many other aspects of the response. With regard to the holy month of Ramadan, the Eastern Mediterranean Office, again in Cairo, has been providing global leadership across our organisation in developing detailed guidance for authorities and for religious authorities on the safe implementation of Ramadan celebrations and Ramadan observances. That advice, I believe, is now available. We also, through the EpiWin platform, through our network for information for epidemics, have engaged specifically with religious communities, and within that specifically with those of the Islamic faith, to work on how we can reduce risks and use the hugely valuable resource of religious networks to get the message across about risk reduction, about hygiene, but also to make religious observance safe. And we thank those leaders in the Islamic community who've engaged so closely with us in this regard. With specific reference to I believe we've had a surge team that has visited Morocco to support there, but I would have to get more details on the specific nature of the technical assistance we've provided, but we'll be very happy to do so. Maria?
Yeah. To supplement that, so Morocco has incredible leadership and work that they've done in the past on influenza and on MERS. And through our regional office, our Eastern Mediterranean Regional Office, have built up capacities over many years, over decades, in terms of abilities for diagnostic testing, which has been valuable for COVID-19. In addition to that, people from Morocco have participated in many trainings that have taken place over the last many years relating to rapid response teams in terms of how to find cases, how to do contact tracing, how to do these detailed investigations around cases and clusters. And so from that work from influenza, from that work from MERS, and now with this work with COVID-19, there's an incredible base to be able to respond. Reflecting on what you've said in terms of 1,000 cases per day, there certainly is a challenge ahead in terms of being able to identify and care for those cases. WHO has provided guidance to Morocco and to all in terms of how to care for cases, how to manage cases, whether these are cases who have mild disease, and they could be cared for in a medical facility or at home safely, and severe cases as well. And so there's guidance that is available to everyone, which we have made available through our website and through our regional office, and to provide an exchange between technical counterparts and people on the front line through our open WHO platform via trainings. So there's a lot of materials that we have provided for all countries, including Morocco, and we know that you have the capability to be able to work through this and to mount a good fight.